Welcome back to the Ed Show. Inflation is falling at the fastest rate in the last 50 years. Energy costs, dairy prices, airline fares, they're all down in March. Over the last 12 months, prices have fallen at the fastest rate since 1955. So why are you paying more when you get sick? One of the largest hospital owners in the country just announced it's going to bring in at least, so I don't choke here, $7.4 billion in revenue in the first quarter of this year. $7.4 billion. Fewer people are checking into hospitals, and this big for-profit hospital corporation is making double what it did a year ago. The Wall Street Journal reported today that prices for about a dozen selling top drugs are going through the roof. The price for a leukemia drug is up 33% in a year. Bristol Myers is now cashing in on cancer. And 3 other top pharmaceutical companies have raised their drug prices by double digits. Joining me now is a guy who has always fought for the American people, a guy I really respect, Ralph Nees. He's the CEO of the National Coalition on Healthcare. Mr. Nees, good to have you with us tonight. What do you make of this? I mean, how do you reel these folks in? They're just predators on sick people in this country, are they not?
Ed, it's great to be back with you. These skyrocketing prices are just outrageous. But as you know, over the last 10 years, wages have gone up 34%, and health care costs have gone up 120%. That's unbelievable. It's no wonder that health care costs skyrocketing so quickly is a major contributor to our economic tsunami.
What do you want the administration to do, Mr. Nees? Mr. Nees, what do you want President Obama and his team working on health care, what do you want them to do about this?
Well, number one, we have to have coverage for all Americans. Number two, we have to address the epidemic of sub-care quality health care. Number three, and very importantly, we have to have cost containment. This country spends twice as much on health care costs per year than the average of all the industrialized countries, and they cover every citizen. We don't have 50 million Americans covered.
Are you
so
disappointed?
We have to have cost containment.
Yeah. Mr. Nees, are you disappointed that the Obama administration has taken single payer pretty much off the table?
Well, Senator Kennedy introduced a single-payer bill a couple of years ago, and there were no co-sponsors.
Yeah.
I think there are a number of ways to get to universal coverage, address cost containment, address quality care, address financing. There are a number of ways to do it. We've got to be pragmatic, principled but pragmatic, and it's got to be bipartisan. But, Ed, most importantly, it has to happen now. We have to have health care reform enacted that's systemic and system-wide in 2009.
Now, tell me that you think this $634 billion they've got in the budget is going to be enough for work and going to be used properly, when it's not going to be throwing it away. Is this going to work?
It's not enough. It's a down payment. It's
not enough?
It's not enough. It's a down payment.
Wow.
We're going to have to figure out how we're going to raise the money to do much better than that. But part of it is addressing the cost issue. In fact, there are many studies that show of the $2.5 trillion spent on health care, if you just addressed quality and efficiency, you could cut $750 billion a year just on that issue alone. But you've got to address prevention. You've got to address healthcare technology. But you're also going to make some hard choices, and we're not addressing them yet. The Obama plan doesn't address some of the hard choices. I certainly hope that the bills we're going to see in the Senate and the House will.
Okay, Ralph, we'll have you back talking about price controls, because I think that is really a possibility. Great to have you with us tonight. We'll visit again. Thanks
Anytime.
so much. You bet. Let's bring back our political panel, Sam Stein, John Ferry, and A.B. Stoddard. John, can you endorse these incredible rate increases on drugs by these drug companies? Is this just the way it's going to be? What do you think?
What I can endorse is some of the great technology that's been done to protect and save people's lives. I'm also going to endorse the Medicare prescription drug bill that was passed by my former boss, Speaker Hastert, that has provided millions and millions of Americans with low-cost health care and prescription drugs to save their lives. And it's one of the most popular government programs that we've got going on today.
A.B., isn't this the kind of story that just infuriates the American people? And is there enough anger maybe out there that this might force some change and bring in some limitations on profit on some of these companies?
Well, obviously, healthcare industry is a business, and they see the landscape, and they know reform is coming, and they decided to jack up the prices so that they don't get discounted down too low in the process. I don't know how much reaction is going to move the White House. The White House is being very purposefully nonspecific and leaving it up to the Congress right now. There's a blank slate, and there are these two beasts. And what Mr. Nez was talking about, coverage and access is different from cost containment, and there's growing concern about whether or not you can cover everybody before you rein in the cost. Can you do them both at once? Obama's silent on this, and that's really a concern. If they want to get this done by August or September, if they don't, we're in a midterm election year.
Yeah.
We're not going to get health care. And I really thought that, these remarks that came out in the paper this week from Dick Gephardt, former Democratic leader in the House, saying we can't do coverage, universal access this year. We have to control those costs.
I think they're going to try to get what they can politically achieve. Sam, this is a big story for your readers of the Huffington Post. I mean, they're on fire for this.
Oh, yeah. I mean, well, there's obviously the human element here, which is that, in all likelihood, less people are going to get coverage now before health care reform can actually be undertaken, which means that it's going to be much harder to do health care reform. Pharma has indicated some willingness to come to the table and negotiate on a comprehensive bill, but they've said automatically that a public plan for insurance is off the table, and that's going to be a huge sticking point. I know a lot of the progressive health care reform advocates want a public plan. They're insisting on a public plan, and it's going to be tricky to get it.
Back where I come from, they have this thing called the Public Utilities Commission, and they got to go through a bunch of stuff before they can start charging people. I don't know why, John, we quickly don't have that in healthcare.
Well, I don't know either, Ed. I do know that with you don't want to screw up an industry that's saving lives. That's all right.
I got to run. John, thanks for joining us.
Bye-bye.
AB and Sam, thanks for being here tonight.